Thank you. There we go. Well, thank you everybody for joining us for Healthcare Management Career Week. We have Dr. Kannan Ramanathan, who is a teacher, a professor in JSOM, and is our Lean Six Sigma continuous improvement guru. So we are going to, he's going to kind of give an overview. We've also submitted the questions that some of you submitted in the registration form. And then if you have any other questions, feel free to raise your hand, unmute your mic, or put a question in the chat box. But other than that, we will get going.
Awesome. Thank you, Ria, for setting it up and making all the arrangements. And good afternoon, guys, for joining in. And I'm just going to click on these things that appear, dismiss. Okay. So to start off, I wanted to introduce myself, give you a little bit of my background. I worked for many years in the airline industry. Now, that's a fun industry to work in if at all you want to move away from healthcare. Airlines or the first time I came to the US was simply because I had a free ticket and a spare weekend, and I came to the US for just one day, came to New York, took the next flight and went back just for the heck of it. Anyway, having left that fun industry, I went to do my PhD. That's when I came to the University of Illinois in Urbana-Champaign. And my PhD is in strategic management. That happens to be one of the courses I teach here, strategic management for healthcare organizations. And after the PhD, I worked for General Electric for almost 9 years, where I got into Six Sigma. And on joining UT Dallas, which is now 12 years ago, I realized there was a place to apply Lean Six Sigma into healthcare. So my areas of interest are strategy, Lean Six Sigma, and also data analytics, all applied to healthcare. So healthcare is kind of my industry of focus. Great industry to be in. And of course, it's a serious industry. We are literally dealing with life and death. So I'm really appreciative of the fact that more and more organizations are getting into Lean and Six Sigma, or more generally, as Ria mentioned earlier, continuous improvement. To be honest, most healthcare organizations shy more towards Lean and a little away from Six Sigma, because the moment they hear these Greek words like Sigma and standard deviation, they tend to freeze a little bit. But Lean is very intuitive, very easy to understand, and it makes common sense. You know, it's to some extent, I almost feel it's not fair on our school's part to charge students tuition to have a workshop on Lean. It's just common sense. I'm just telling you what your parents, your grandmother, your peers always would be telling you about. So in that sense, it's very down to earth philosophy, makes intuitive sense, and is a good segue to something more technical like Six Sigma, for instance. So having said that, wanted to also mention some of the certification levels that are available. Now, one thing you need to understand, and this is going to be really strange because Six Sigma has been around for about 35 years now. But to date, there is no one body, there's no one organization that sets the rules to say, here is what a certificate in Six Sigma should comprise of. So tomorrow, if RIA decides to set up the RIA Institute for Six Sigma and hand out certificates, $10,000 a piece, you really don't need to study anything. Nobody is there to question, how she could do that or what's the validity of the certificate. So having said that, you will realize immediately that different organizations have their own take, okay? For example, UT Dallas, which of course is a very reputed, very accredited institution, we require any student wanting to get a certificate at the Greenbelt level to also do a project, which takes several months. On the other hand, if you go to the American Society for Quality, again, a very reputed worldwide institution, they will give you a Greenbelt certificate if you just do an exam, no certificate required. So I mentioned that to two well-known institutions, both offering a green belt certificate, but very different requirements, very different costs. So one thing anyone wants to watch out for if you want to get a certificate is to understand what the different certificates are and then where to go for that. So with that said, I will just speak for a moment about the certificate levels. The guy who got into this whole martial arts terminology, he himself was, I'm told, a karate or judo expert, and that's why we have the martial arts terminology. It certainly makes the field much more sexy, so to speak. In other words, instead of saying basic level in process improvement, it sounds much more impressive if you say you're a black belt in process improvement or black belt in Lean Six Sigma. So the guy had a good marketing idea. I know a number of people who want the certificate not because they want the content, but they want to be known as black belt. But if you're like me, you really don't want to be working out for quote unquote a real black belt. So you get one in Lean Six Sigma. Okay. So the basic level is a yellow belt, and the yellow belt is kind of a familiarization. Familiarization meaning, yes, you're aware of the terms, you know the distinction between Lean and Six Sigma, and you have some idea of how these things can be applied. The next level, the next higher level is a green belt. And as I mentioned, it gets a little deeper into the whole Lean and Six Sigma process. Some organizations like UTD require the candidate to work on a project and show some improvement in whatever they are doing. If you really want to get into it for your profession, then you go to the black belt level. A black belt would be somebody, by the way, I'm a black belt, and the way I get my black belt or I got my black belt would be to not only do two huge projects, like bigger projects than at the green belt level, but also teach 10 green belt candidates and help them obtain their certificates. My certifications are through General Electric, and they had a fairly rigorous way to conduct their exam. We had to do an exam, and then we do these 10, assist with 10 different projects, and then do 2 projects ourselves. So that was the requirement. Depending on your area of interest, you should, at the minimum, get a green belt and actually work on your project. And nowadays, I do know that anyone looking to hire people with a Lean or Six Sigma background, ask for some evidence of the background. You know, where did you get your certificate from? Did you do your project? And if you got your certificate from a recognized institution and you have worked on a project, yes, that definitely helps to add to your credentials. I'm just going to pause for a moment and ask if any of you have any questions. And I do have a list of questions which you had submitted, so thank you for sending that across. And it turns out I just addressed the first of the bullets that I had here, brief explanation of each certification and belt, and how can a certificate or getting a certification help me in my career. So you want to get into Lean Six Sigma or process improvement, you do want to have a certificate. And it's pretty easy. For one thing, JSOM, our School of Management and the Healthcare program, we have designed the courses such that if you take the quality class, which we teach in summer of each year, and if you're a master's or an MBA student in the healthcare program, then you automatically are taking certain other courses. And if you take 4 courses together, 3 core courses which you're going to be taking anyways, and then the elective, which is the quality course in summer, then we give you a yellow belt. Okay, you don't have to pass any exams other than the course itself. You do need to get a B or a higher, and trust me, you have to try hard to get a C or fail. Okay, it's really easy. It's common sense. So as long as you're applying your common sense, you should be able to get a B, if not definitely an A, and get the yellow belt. Okay. If you want to go beyond that, we offer students an opportunity to work towards a green belt by working on a project. So here is where we tend to differ from the American Society of Quality. The American Society for Quality, they will give you a green belt without a project. We require you to do a project. So here is how one of my students kind of gamed the system, if you like, and I say it in a nice way. Uh, she did her green belt through the school and worked on a project. And then she got a job and she got some work experience where she again applied Six Sigma. Then she went to ASQ because ASQ requires you to work on projects for their black belt. She took the two projects, went to ASQ, passed their exam, and now she's black belt certified, and she's actually working for the ASQ editorial board and so on and so forth. So there are lots of opportunities, but keep in mind that this is simply an additional certificate, an additional credential. And some of the questions that you had submitted speak to what can help us to get into the healthcare industry. And here I have my own take on this, which is when you get into, you are applying for a job, the first question you're going to be asked is, well, what are you going to do for us? And if you tell them, like some students tell me that I'm not a detailed person, I'm a big idea person. Thank you so much for coming in, and we'll look forward to maybe future opportunities for you. Okay, so you should be prepared to go walk in, get your hands dirty, literally do anything that takes to show that you are a committed, serious person. Okay. In fact, although I teach strategic management and that's a required course, honestly, that's such a high level. Some of you are in my classes and we speak about things like mergers and acquisitions. And just think about this. If you're applying for a job as a fresh graduate, I mean, much as I appreciate you're very skilled, very smart, I'm really proud of you guys, very smart, but you will not be able to walk in and say, okay, I'm going to help you with your mergers and acquisitions. You follow? Okay, so you need to be able to do something at a lower level, kind of establish your reputation within the house by doing one of maybe two or three things. First one, everything now in healthcare is driven around data. So you definitely want to know how to do basic things, okay? Basic things with an Excel spreadsheet, with a database. So if you're at all interested in those areas, you should explore. By the way, Excel is kind of a basic thing, okay? So you really want to have that no matter what kind of job you're applying for, you do want to know how to use Excel, PowerPoint, Word, all those Office suite of applications. To take that one step further, you want to be able to apply maybe SQL, for example, how to use an Access database. If you want to take that further, statistical packages like R or or SPSS or SAS, okay? R is a good starting point because it's free. And I'm expecting that many small to medium organizations will be adopting R compared to SAS. SAS is expensive, and typically only larger organizations buy the SAS program, SAS or SPSS. And of course, you understand that there are more smaller to medium organizations than very large enterprises. Okay, so you're opening up your market by focusing on R database, like learning SQL, that's written SQL, and being familiar with kind of the basics of data management using spreadsheets and so forth. I teach different courses at UT Dallas, and one course, in fact, I'm embarrassed to say this, the only course that students write to me after years is about the spreadsheet class that I teach. They tell me how useful it was. My strategy students or my Lean Six Sigma students, I usually never hear from them. But the spreadsheet class, they write and say, we learned a lot in this class and we are able to make an impact in our company and so on and so forth. So definitely quantitative data skills is going to be helpful. So the idea is you walk into a company, you should be able to say, I can do this for you. I can pull the data of your EHR. And that is my segue into my second topic. You remember I said there are a couple of things you can do. The first one was just familiarity with data analytics. And the second one would be, I know how to use your electronic health record system. EHR, of course, the big one there is Epic. And if you learn Epic, either you Epic doesn't make it easy for you to learn about the Epic software. And you're truly, and I say this without any bias, you're truly fortunate to be here at the School of Management here at JSOM, because we have a license to actually teach you how to use Epic, and we have Professor Stevens who working on this with you folks. Okay, so this is a tremendous opportunity. Ria, I don't know if I told you that, but I'm planning to ask Tim Stephen to let me in as a student and audit these classes. They
That's
really,
great.
it's so much. Yeah. I mean, I'm just so excited by the idea that we have this in-house. You talk to some people outside, they say, oh, Epic, you have to be sponsored. You have to have a sponsor behind you, or you have to work directly for Epic. Otherwise, it's not like you go to the teaching course training programs for Epic, you can't find one of those. Okay, so strongly recommend that yes, you advance your data analytics skills, and second, get into electronic health records. And here is one nice thing, maybe not nice thing, depending on how you look at it, about Epic. Epic is very controlling. They don't want too many variations. Okay, so if you're a hospital administrator and you want to make some changes, you're not going to be happy, because Epic will say we are not going to allow that, or you can do only A, B, not C and D. But from the perspective of a student, it is tremendous, because if you learn Epic, chances are any other organization applying Epic is following almost the same textbook. You follow? There's not going to be like 10 versions or variations on Epic, that it's going to be different at each point. So your marketability and your skills go up tremendously. So
yeah, and I wanted to
yeah.
point out too that that class used to be offered only once a semester, but it's now being offered every spring and fall. If anyone is interested, it's HMGT 6327, electronic health record application. So if you're interested, enrollment's coming up in a few weeks, so you can kind of keep that on your radar. And then we had a question if UT Dallas provides EPIC certifications. My understanding is that we do not. Is that accurate, Dr. Ramanathan? Do you know?
I don't know that for a fact, but I'm inclined to think that's correct. The certification part usually tends to be at a higher level. Okay, so kind of corresponding to the Six Sigma levels that I mentioned, what we do would be akin meaning similar to the yellow belt. Okay, so you're getting some familiarity, but to be certified, and if you folks are familiar with SAP, SAP is for companies where they have different modules like HR and manufacturing and finance and so forth. In EHR, you have some corresponding modules, like Epic will have something called Radiant, something called Willow for pharmacy, imaging, ambulatory patients, and each of these different categories. So your certification would be within one of those areas. So you're kind of getting specialized. You're saying, okay, I'm going to do Epic in the area of pharmaceuticals, meaning drugs, supplies, distribution, those kind of things. Okay, and then you would specialize in this module called Willow. Okay, that specializes only in that particular domain, so to speak. Yeah, I'm disappointed you guys are already looking at Epic certification. You guys don't have any questions on Lean Six Sigma certification? I'm kidding. By the way, guys, you really don't know me. I tend to joke around a lot. So if something I say sounds really strange or weird, that was just my attempt to be funny. Okay. Okay, let me go back to my
Dr. Ramanathan, can I have you clarify one thing a little bit? You mentioned Lean and Six Sigma, and can you kind of talk about the differentiation between the different sort of quality improvement, process improvement, and kind of how those are different for those who are unfamiliar?
Right. So the term Six Sigma was launched on a specific date, sometime in 1986 in a company called Motorola. And Lean, on the other hand, has kind of got many, many parents. Okay. Six Sigma was introduced by one person in one company. Lean, on the other hand, is a collection of concepts, many of which originated in Japan and in the United States and elsewhere. And they have been kind of put together under the umbrella of Lean. In fact, till the late 90s, there was not even the term lean. The lean, the collection of terms or concepts have been around for maybe 150 years, but only in the late 90s, somebody thought to give it a name lean. And under that lean topic, things have become codified. So till then, people were talking about Six Sigma first, then about lean, although lean concept wise is much older, as I mentioned, 150 years. And much more recently, people have talked about how these two topics are very complementary. So Lean Six Sigma is kind of an umbrella term, but the way we still teach it at school, at JSOM, for instance, we have half the semester on Lean and half on Six Sigma. Lean, the key part about Lean is how to avoid waste and how to eliminate unnecessary steps. And in Six Sigma, we are looking more statistically. We are looking at, is it taking a lot of time, and are different people taking different amounts of time? In which case, the question we would ask in Six Sigma is, why is there so much variation? Okay, one person takes 10 minutes to do a job, somebody else takes 10 hours to do a job. Why is there that variation? In Lean, we are looking at whatever they are doing, is it really necessary? Can we knock something out? Can we eliminate some step, for instance? Okay, so kind of the broad things about Lean and Six Sigma. And Ria was asking just a moment ago the distinction between Lean, Six Sigma, and where these fit into process improvement. Both Lean and Six Sigma are different ways of looking at process improvement. So process improvement would be, what is the concept? Are you going to apply, are we going to have a quality week? And people do that, right? We have Mother's Day, Father's Day, we have a day to recognize mental illness, and we have a day to recognize so many other things. We have Halloween coming up, and then after that, Valentine's, and so on and so forth. So what's my point with all these dates? So are we going to have a quality day and say designate the 1st of October, for instance, as the quality day when we all work on quality? Okay. And this is how it used to be done. But when you're talking about process improvement, it's not like one day you celebrate Father's Day and tell him how much you love your father, but you want to do that on a daily basis, demonstrate that every day through various actions and activities. Okay, so it's a continuous process. That's the idea behind process improvement, or the Japanese word kaizen, if you want to be fancy about it, or lean and Six Sigma applied on a daily basis. That's really what we're talking about. And honestly, even in your personal and practical life, I think it makes a lot of sense. Every day I look at my day, and it's not like I sit and deliberate on it. That would be really weird. But I think about my day and say, well, how much of it was really value added versus non-value added, and I really try to eliminate. Okay, maybe I shouldn't be binge watching Netflix for 8 hours in the day. You follow me? Okay, so it kind of applies to what you do on a daily basis. And my wife is a black belt, and when we talk, we use the same language at home. It helps us focus on, hey, here is what we want to do. What is your priority? You want this, A, or you want B? And how do we get to A or B? And can we really skip steps E, F, and G? Because you know what? It's all wasteful. So a lot of practicals. practical application. And again, you really don't need to take a course. It's just the course is just giving you a framework and a structure to think about these things more systematically. But Ria, you have to stop me. I get carried away by my own speech. So.
Oh, you're fine. You can go for it. I think you're about to go on to your third point.
Okay, thank you, ma'am. Is Lean Six Sigma certificate worth the time and the money? How far should one go in the certification process? Green belt versus black belt. I would say at least green belt. Again, if you want to get into this field, okay, if you want to get into this field, get your foot in the door, yeah, green belt. And you guys are so young. You have the entire century ahead of you. You should be able to determine if that is something you enjoy doing. Okay, and if you like it, then yeah, go for your black belt, because you would need a black belt if you want to make your career in that. And here is the really nice part. It is not at all difficult, okay, to get your black belt in this. How much should you spend on it? And here you have to be careful. And I really love this question because, do you really want to spend like $500,000? No, definitely not. On the other hand, here is an email I got, I think it was 3 months ago, from one of my former students who asked me this. And I'm just going to give you the gist of what he said. He said, I came across a Groupon. You know the Groupon? You get these coupons online, and he said there was a Groupon for black belt for $80. Please don't do that, okay? Because that makes it so suspicious. If any of you do that, I'm going to be wondering, my goodness, I don't want to look at your certificate or where you got it from. I'm really going to look at you as a person and say, what do you think you would be getting for $80? You follow me? So important. I'm not trying to sell JSOM or the programs we are offering, but definitely go with an accredited institution. And guess what? We charge for the green belt, we charge $2,500, and the students work on a project which takes maybe 8 to 10 months. So it's a fair amount of investment. On the other hand, ASQ will give you a green belt, and they charge just a few $100s, and you just need to do an exam. You don't even need to do a project. So if you're going to invest some amount of money, I would say at least go with ASQ, which is reputed, and you will have a green belt. And if you like that, then get into it, like invest a little more and get into your black belt. But here is one thing you want to keep in mind. If you get your green belt, then you have an understanding of the DMAIC framework. Sorry, I'm using a little jargon here. It is a Six Sigma framework which tells you what the steps are. Then you're going to be applying those steps. So apply it to whatever work you're doing. And at some point, if you decide I'm going to apply for my black belt, you already have your portfolio of projects that you can take to ASQ and say, hey, I have been applying this. And trust me, they want to certify people. They want to be able to tell in their annual report, we have certified 100,000 black belts last year. I go to their ASQ meetings and they proudly present these statistics, how they're growing. So they want to certify you, you want to be certified by them. Just check out the rules and go from there. Okay. What else can I answer for you?
We have a question about entry-level jobs. So are there entry-level jobs that are specifically for those who are Six Sigma certified, who that's kind of their interest, or is it a little bit looser than that?
Yeah, it is definitely looser than that. The Lean and Six Sigma certificates, they're not going to help you get a job in that particular field. You must have some other certificate, like you're an expert in data analytics. You know how to pull data with a database, for instance. If you have these requirements, then the Lean Six Sigma certificate, whether it's a green belt or even the yellow belt that we offer at UTD for our healthcare management students, that is going to be an extra certificate. But you cannot bank on that alone. Nobody will take you into a hospital or healthcare organization purely on the basis of your yellow belt certificate or your green belt certificate. Yeah, you need to have something more. Of course, if you have a black belt, yes, now I'm interested in talking with you to find out where you have applied your black belt knowledge, where you have got your certificate from. There would be interest. But at the level that the yellow belt is covered and the green belt is covered, meaning the scope and the coverage by these two levels, that's not going to be sufficient. But yeah, you have data analytics background or healthcare information analytics, any of those, and you have a Lean Six Sigma certificate. Yes, now you're cooking.
Yeah, so it sounds like what you're saying is you can kind of get a job in the healthcare field and then apply those concepts and then begin to work more and more kind of in that area.
Absolutely. And in some of these certificates can get expensive. If I'm not mistaken, I don't want to mention a name since I do not know the numbers exactly. But this university offers a certificate for people in black belt, and they charge upwards of $9,000 to $10,000 for the black belt. Okay, and if you were to ask me, do you think you should be investing that kind of money? No, I would rather join the hospital, tell them I have a yellow belt, green belt, work in that area, demonstrate my interest, and then after you have shown your commitment, maybe a year later, tell them, hey, I would like to go for that training. Would you send me? And then, yeah, then companies and hospitals would like to do that. They would like to invest in that. It's definitely not going away because more and more people are seeing the benefit of doing this. And again, as I mentioned, lean more than Six Sigma. Okay, they see the benefit, and the more you invest committing experience in that particular field, it's going to be more helpful for you. And just every hospital I know in the Dallas Fort Worth area and elsewhere are getting into they have their own program. For instance, Baylor Scott and White, it was more the Scott and White part of Baylor Scott and White. Just in case you're not familiar, Baylor was one hospital, Scott and White was another hospital south of Dallas in a place called Temple. They merged a couple of years ago. Now it is Baylor Scott and White. And it was the Scott and White folks who were really into process improvement. And I know those people used to come from Temple to teach out here in Dallas. They train their folks in the Baylor Scott and White Hospital now. So people are getting into it. They have their own departments, like Scottish Rite Hospital for Children has its own group of green belts and black belts. They spend time on doing process improvement, and they're doing this every day on an ongoing basis. And trust me, you'll see a lot of improvement. Move from the classroom where we do everything on a textbook basis to the real world, you'll be shocked. You'll be asking, my goodness, do you really do things this way? Hopefully you will not be saying it aloud. Okay, what else can I answer for you?
We have a question. What is the difference in skill level from belt to belt? Besides just the certification, is it useful in a knowledge and skill level? So kind of can you kind of go over again, kind of yellow, green, black that you were talking about?
Yeah. The yellow belt is what we offer for our students. So for our students, and again, keep in mind, this is going to differ from institution to institution. And the way we have structured our yellow belt certificate is you need to do the quality course, which is offered in summer each year, get a B or higher in that particular course. And if you're in the healthcare program, you're automatically taking other courses such as the American healthcare system, the strategic management for healthcare organizations, and so forth. You're taking 3 other courses. So those 3, which you would be taking anyway, by the way, we chose those 3 simply so we are not adding to your burden of studies. So we are saying you already have these 3, then we kind of make it a package to tell anybody else. It's not just based on one set course, it's based on a cluster of courses. So our yellow belt is kind of more special than the rest of the world out there. Okay, so the yellow belt, but it gives you a familiarization, what is lean, what is Six Sigma, and so forth. The green belt, and the way we distinguish the lean Six Sigma yellow belt from the lean Six Sigma green belt is, for the green belt, you actually have work experience. And this is particularly helpful for our international students who, by definition, they're international, meaning they're not US citizens, and they're looking to get work experience here without it counting towards their OPT and CPT and etc. And without having to apply for a work permit. And this is an academic project, and it gives you work experience for anywhere from 6 to 10 months. Okay, and I do suggest that you put it on your certificate as work experience, and then you get into the habit of interacting with, hospitals, senior, encountering senior management. So it's a good opportunity to learn to work at senior management levels pretty quickly without the requirement of, are you a US citizen? Do you have a work permit, and so forth? So many international students find that very helpful. Okay. Again, I hope I'm not giving you TMI. You know what that is? Too much information. So just let me know.
I think you're doing great. We have another question. How does Lean Six Sigma relate to project management? Are they similar or overlapping in any way?
Yeah, that's a great question. And that's actually, I see that on the list that I have here. And the project management, it's a good marriage between getting your green belt or a black belt certificate. If you tell me I'm already a black belt, what else can I do? I would say, well, go and get a PMI. PMI is from the Project Management Institute. So how to conduct a project. I want to go back to an earlier question, the distinction between the yellow belt and the green belt. At each level, you're doing more project management skills, for example. So the yellow belt, not really. You're not doing much of project management. Green belt, to some extent. Black belt, definitely. Okay. So the parallel is, as you go up in the levels, you're learning more about not just how to do the statistics part or how to do your process map. You're also learning how to manage a team of people. That is what comes in the project management side. So it's definitely a good combination. Now, if you were to ask me, should you spend your money and time on the project management part or the Lean Six Sigma part, I would say it again depends on your area of interest. Always, always, and one more time, always be guided by your passion. Okay, if you, like, some people tell me this whole, I hate the idea of programming and software and database. Yeah, then don't go into electronic health records or anything like that. If it doesn't really turn you on, don't go for it. Okay, so you have to get your foot wet. I mean, dip your foot in the water, see if you like the temperature. If you like it, then plunge in. If not, again, you have a century ahead of you, literally, and you should go and find something else that excites you. That's the mistake I think students make, is trying to look for jobs or to make somebody happy. And but by the way, this is a true story. I had a Chinese student. When I spoke to her, she was, I'm sorry, I shouldn't mention any international. Uh, anyway, it doesn't matter that she was Chinese or not Chinese, but uh, she was really smart when I spoke to her, but she did miserably in her exams. So I called her to my office. I said, "Can we just chat?" And then she started crying, and she said she was the only girl, only kid in the family, and her parents wanted her to go to business school. Now I noticed she would always wear excellent clothes. She was very, very fashionably dressed, and she said, "You see my clothes?" I said, "Yeah, I designed them myself." And that's what I want to be doing. I want to be in the fashion industry. Okay, like she wanted to be in designing clothes and so forth. And I told her that, she should reach her parents and tell them that maybe they didn't realize that she was so unhappy being in the business school and not doing well. And clearly, she, if her clothes were any example, she would be very, very successful in the fashion industry. So again, don't look for the money part, it'll automatically follow. Just go follow your passion, and the don't go after the money is what I'm saying. The money will follow your passion, because you'll be able to bring that excitement into it, and you'll be able to show people. Otherwise, it's drudge. I have fun. When I joined UT Dallas, I was at the same time interviewing for a couple of companies, and I always thought at some point I'll go into corporate life again. But I'm having a blast. I don't think of it as going to work. I'm having fun. Please don't tell the dean. I don't want him to take my paycheck away. But he will ask me to pay him if he knows how much fun I'm having.
We won't tell, we promise.
Thank you. Thank you.
We've got a question. If someone is in healthcare management and ITSS, will a yellow belt help land entry-level roles in hospitals?
Oh yeah, the yellow belt is definitely a good thing to have under in your sorry, no pun intended, but under your belt. Okay, so that you will be able to have a familiarity, you'll be able to talk the language. When I joined GE, I just had my PhD, and I was really proud of my PhD. It was way more work than I expected, and I'm not afraid of hard work, but for me also it was a lot of work. And when I joined GE, they said you have to get your green belt certification, and I was almost laughing. I said, I just came with my PhD, and you want me to do a 2-week course? And they said yes. And by the way, if you don't do the course and if you don't do your project, you're fired. And they were not joking. It was like on day one. That's the first thing they literally told me. And after going through that training program, I realized how practical it was. So I can apply it. As I mentioned earlier, I apply it to my daily life. And so, short answer, if you're in information technology and if you're already doing something in healthcare or you want to be in healthcare, having the yellow belt is definitely going to help you, assist you in getting into it. But again, when you say you have a yellow belt, I'm also assuming you're familiar with the topics and the concepts and so forth, because people will ask you, and if somebody asks you what is lean and you're not able to explain, then the fact that you said you have a yellow belt kind of reduces the value of everything else, because you're not able to back up your claim with substance.
Kind of in that regard, what advice do you have for students who, for whatever reason, it doesn't work in their schedule to try to do the yellow belt classes to actually get a specific certification? Do you have recommendations on resources or things like that for students to sort of learn about it themselves on their own, so they would be able to speak about it in contexts like that?
Oh yeah, really simple. There's a book. It costs, I think, less than $12 on Amazon. It's called Lean Pocketbook, and it's kind of a primer or a refresher if you're already familiar with the concepts. It's a small pocketbook, and it's definitely going to give you a kind of a walkthrough the different concepts that are applied in Lean. So at the very least, I think you should be able to get that book and educate yourself. As I said, it's common sense. It's definitely not difficult to read a book. And many of these books are pretty interesting. They'll tell you how a company applied Lean or Six Sigma, what kind of progress they made, and so forth. So a lot you can pick up from basic books. And there's plenty of material out there. If you go to YouTube, again, that's a free university all by itself. You just type in Lean or Six Sigma, and just, you can look at it on your phone or whatever media appeals to you. Spend some time familiarizing yourself with that. So definitely you don't have to go to a course and do a formal program, because the more formal the program is, the more expensive it would get also. So you can learn. If you just want to learn the concepts and say you have a familiarity with these concepts. Please don't say you're certified, okay, because you're not, but you have a familiarity. I would say, yeah, study by YouTube, or of course, reach out to me anytime, and I'll be happy to point you towards some resources and tell you where you can go and find stuff. Along the lines of not necessarily a course, what else you can do to get into healthcare? There are many opportunities for students to be a volunteer. Okay, you just need to get your foot in the door, and once you make yourself known to the organization, then if there are some opportunities, guess what? You're already inside the organization. All that you need to do is to talk to the right people. So I would say talk to company. By the way, it's not like you tell a hospital and they will hire you overnight. By the way, these are not paid, just to be clear. You're just literally volunteering your services on an unpaid basis. But and it's going to take some time. That is important to keep in mind. It's going to take time because many organizations will want you to have a medical exam, make sure, for example, you have taken a flu shot, or you have taken whatever vaccines are currently available, that you are up to date in all of these. You should be prepared for all that, because they don't want you coming in contact with patients and accidentally either getting something from a patient or giving something to a patient. Okay, so we are talking about a very vulnerable population, so you need to take care of those. That's partly what makes this industry so much more exciting, because you're really dealing with life and death, and you should be prepared to take the precautions. I told you earlier that the airline industry was a fun industry. Yeah, it is. Airline industry is a lot of fun. The healthcare industry, no, it's much more serious, but again, very responsible. Okay, and there you really have to be focused and bring to bear all your skills and attention and so forth. It's not like you can do a job while you're doing something else. You can't really multitask within a hospital setup.
Very,
What
very true. Yeah. What does anyone else have questions that you'd like to either put in the chat or unmute yourself?
Okay, I had one other comment. There
Yeah.
are also organizations like ACHE, and they offer mentorship. Okay, so and maybe you think you don't need one, and maybe you really don't. Okay, you don't. You know, whatever a mentor would tell you, you're already familiar with that. I would say still go ahead and take up that mentorship opportunity simply to network. Okay, it's not that I'm going to be your mentor, I'm going to teach you great stuff or give you great insights from my past. Maybe I just happen to know Ria, and I will say, hey, do you know you can talk to Ria about this, and give you some connections. And networking and connections and persistence. Okay, many students come to my office and they are literally in tears. And I hear this story all the time. Okay, and I'm just going to pick on a couple of people I see on the screen here. Karun comes to me and she says, Hillary is my roommate, and I'm doing so well, but I've applied to so many jobs, but Hillary got a job, but I have not. What Karun does not know is Hillary was in my office just before she was, with pretty much the same kind of story, literally. Okay, so everybody thinks the rest of the world is getting a job, great internships, great positions, fantastic pays, and I'm the only one who's left out. That's Everybody is going through that. Everybody is going through a tough time, okay, especially in the current environment. The thing to look upon it is, yeah, it is tough, but let's look at it positively. What are the opportunities out there? Can you come up with a new way to take into account the opportunities that you're being presented? How can you leverage that? If you walk into a healthcare organization, can you tell them about how many COVID patients they have seen in this year compared to the rest of the hospitals in that area? What are the statistics out there? Have you done your homework? Well, one job I got, which I really loved, I swear, I think I've got the job simply because I had a folder with that company's name on it and a lot of paper inside. I had done some work. It was not just an empty folder, but the folder was boldly labeled like XYZ, the name of the company. And, and they asked me some questions and I knew the answers, but it was more showing that visual that I had a whole file on them, that I had done my homework. Okay. So you should be able to do that. If nothing else, at least carry a file with a lot of blank sheets.
It's all about the image you present.
It's all about the image. Absolutely.
For sure. We have another question. After getting Six Sigma certified, are there any internships that can help put your Six Sigma skills into practice?
Yeah, the way you would put your Six Sigma skills into practice is by working on projects. And one way you can do this is definitely by joining associations. For example, at UT Dallas, we have the Student Association of Lean Six Sigma. And I happen to know, because I'm the faculty advisor, that we are looking for officers to staff the association. Many of our past officers have left. We're looking for new officers. Now, this association, again, SALSS, Student Association of Lean Six Sigma, is not specific to healthcare. It encompasses supply chain, finance, everybody else who's got an interest in Lean Six Sigma. So we would love for you guys to join in, learn not just healthcare, but about non-healthcare and how it is applied. Okay, so when you do this, you automatically network and you do come into contact with people. You can work on projects. You can join the American Society for Quality as a student, and it's really discounted. I don't remember the cost offhand, but it's pretty inexpensive. And you can join the ASQ, and then American Society for Quality also have a healthcare group, a subdivision, if you like. So you want to be a member of the healthcare group and just ask how you can participate, how you can contribute. Some of you may have heard of St. Jude, okay? And the St. Jude was taken over. I'm not talking about the St. Jude Children's Hospital, but St. Jude, which is now taken over and purchased by Abbott Laboratories, and they are in Plano. And the ASQ healthcare group meets in the Abbott. If you just show up, by definition, you're going to bump into people from Abbott Laboratories. And I'm not saying you bump into them and say, hi, here's my resume. Okay, but you develop a relationship with them, and over a period of time, if they have any positions, I'm sure you'll be the first person they think of. So you want to get in and work on this. Okay, I realize I'm not answering the question directly. The question was about internships and Lean Six Sigma. If you're willing to work for free just to get the experience, there are places, THR, for instance, they do hire many students to work on a voluntary basis. You can work with them, for instance. But again, you can volunteer. Methodist Hospital, the CEO of Methodist Hospital is a regular guest speaker for us in the healthcare program. Ken Hutchenrider, you can very open to meeting with students. I know many of my students go to meet with him one-on-one. You need to do that. Feel hurt. It's not you. If they say, sorry, we can't, who are you and why are you here? Sorry, we can't see you. That's okay. 9 people say that, the 10th person offers you a job. That's all you need. How many jobs do you need, Karun? More than one? One, yeah, just one, right? Yeah, just don't be afraid to ask. I mean, of course, ask nicely, okay, but don't be afraid to ask. And I saw a hand go up.
I don't think so. So we have just a few minutes left in the meeting. Do you have any kind of, from your experience, what do you wish you had known as a student about to enter the workforce? What are some of those things you wish you'd known or tips that you have for students?
Oh, the importance of math. honestly, mathematics and statistics. In fact, well, I will tell you, I would love to do a course in mathematics or statistics or counseling. But that's my problem. I can't make up my mind. When we started, I was telling Ria how I'm going to join up for a course in EPIC. Never stop being a student. There's always so much to learn. And every time I look at my stuff and I'm struggling with Facebook, you know what? I don't even have a Facebook account. Seriously, guys. Okay. And I'm not, I think I have a Twitter account which I opened many, many years ago, but I've never used it. You guys are so savvy with social media and things like that. Again, you should be asking yourself, I have the skill with social media. How do I apply it to healthcare? Okay, so I always thought of studies this as separate. I'm thinking about everything as integrated. So if I look back on my past, I'm thinking, well, I wish I had been able to integrate everything instead of looking each of these separately. And I know we are almost out of time, but if any of you have any questions, you want to follow up with your chat, I think my email address is out there. Just shoot me an email, and I'm just plugging in my laptop because I don't want to be powerless. So I feel empowered now. And yeah, just reach out and ask me any questions, or if you just want to chat, please do that. It's kind of boring, by being by myself here at home without talking to people. But I'm getting used to it. It gives me more time, actually. I'm not
For
commuting
sure.
to school every day.
Yes, and this is an excellent time to ask for those meetings one-on-one with those mentors and things like
Oh,
that
yeah.
because
Yeah.
it's a lot easier now since everyone is used to the virtual environment. So that is
Yeah.
one thing that has been a benefit of the pandemic. So
Okay, I see that we are almost at the end of our hour. So you guys out there, be safe and healthy, and make sure you wash your laptops with soap after we finish this conversation.
all right, thanks guys. Thanks so much for coming. We're glad you were here.
Thank you.
you.